My name is Juwanna Holley-Woods, and my campaign is Disparities in Maternal Care. For this theory-based health communication campaign, the health behavior I'm most interested in addressing is reducing disparities in maternal care by improving access to culturally competent community-based support services for pregnant and postpartum women. The Michigan Maternal Mortality Surveillance Program data shows that between 2016 and 2020, 467 maternal deaths were reported, with 106 identified as pregnancy related and 305 as pregnancy associated, but not directly related to pregnancy. The most common causes of pregnancy related deaths were infection, thrombotic pulmonary embolism, and substance use disorder, while pregnancy associated deaths were largely due to accidental poisoning, drug overdose, and medical causes. Importantly, disparities by race, age, and education level were evident across both categories in most deaths. 74.5% of pregnancy related and 81.8% of pregnancy associated were deemed preventable. Social cognitive theory offers a robust framework for designing a health communication tool to address maternal health disparities in Michigan. Given SCT's emphasis on the dynamic interaction between environmental influences and internal psychosocial factors, a culturally tailored digital campaign could be developed to empower expectant mothers, particularly Black women who face disproportionate risk with knowledge, role models, and self efficacy. For example, a mobile app or social media series could feature relatable peer stories, interactive prenatal care guides, and video testimonials from trusted community health workers. These elements would leverage observational learning and reinforce positive health behaviors while also addressing barriers such as low health literacy and mistrust in the healthcare system. By embedding SCT principles such as outcome, expectations, self regulation, and reciprocal determinism into the tool's design, the intervention could help shift perceptions, build confidence, and promote proactive engagement with maternal care. Segment 1, Transformational Objectives. The campaign is built around a progressive model utilizing 5 measurable objectives that target the key levers of behavioral and systemic change. Objective 1, Awareness. By the end of 2026, we aim to increase awareness among healthcare professionals regarding racial disparities. We will measure this through a 25% increase in participation in our equity focused workshops and webinars across Wayne County. Objective 2, Empathy and Motivation. We recognize that knowledge alone is insufficient. By June 2026, we target the internal commitment of providers and leaders aiming for a 20% improvement in confidence and commitment by addressing systemic racism and implicit bias measured before and after training. Objective 3, Community Engagement. To ensure immediate local impact, our due objective for 2026 is to establish at least 5 active community partnerships with nonprofits, advocacy groups, and faith based organizations to deliver culturally tailored resources directly to expecting mothers. Segment 2, Policy and Long Term Outcome. Objective 4, Policy and Practice Change. Driving lasting institutional change is critical. By the end of 2027, we commit to ensuring that at least 3 new county level policies are enacted. These policies will focus on expanding access to culturally competent care and diversifying the maternal health workforce. Objective 5, Outcome Impact, long term. The ultimate goal is measurable health impact. By 2028, we aim for a 15% reduction in preventable pregnancy related deaths among Black women in Wayne County, tracked directly by using official MMMS program data. This is how we measure true success. Segment 3, Rationale, why these objectives work. These objectives are not aspirational statements, they are robust, strategic goals that adhere strictly to SMART framework. Specific. Each objective clearly targets and explicit action, whether it's awareness training, policy enactment, or death reduction. Measurable. We have clear, quantifiable indicators such as specific percentages, the number of policies, and the number of partnerships required. Attainable and realistic. They are achievable within the public health infrastructure we have in Wayne County, making them realistic. Time bound, and crucially, every objective has a strict deadline between 2026 and 2028, ensuring accountability and disciplined progress. The social media banner titled Maternity Mortality in Michigan is an informational graphic focused on state and county level data and emerging developments in health communication related to maternal health. Here's a breakdown of the key elements: header and visuals, title Maternity Mortality in Michigan, subtitle State and County Level Data. Visual, a large stylized illustration of a pregnant woman on the right side, colored in shades of orange and terracotta. Key statistics in the box, center right. This box contains critical data presented with clear icons. Icon is three stylized figures suggesting a family or group. Statistic 1, 81.8% preventable pregnancy associated deaths. Statistic 2, 305 pregnancy associated, presumably the total number of deaths mentioned above or the number of deaths in a given period. Emerging developments in health communication. This section under the heading Emerging Developments in Health Communication is divided into three columns with icons and descriptions: digital health platforms and telemedicine. Icon A is a heart with a plus sign, medical cross, and a phone signal symbol. Description: expanded access through telehealth to prenatal and postpartum care to meet early detection. Community-based messaging and culturally tailored campaigns. Icon 2, stylized figures facing each other. Description: reaching high-risk populations using community health workers, incorporating cultural values and language preferences. Data-driven communication and predictively analytics. Icon, a bar graph with an ascending arrow line graph. Description: enhanced intervention targeting through predictive models, visualizing disparities and tracking care. And the footer is an orange and red bar. Introduction to evaluation. On this slide, we outline our strategy for measuring the campaign's success. It's crucial that we don't wait until the end to assess impact. We need to be nimble and responsive, especially when dealing with sensitive and high stakes health issues. Evaluation type: formative evaluation. Our primary approach will be formative evaluation. The key takeaway here is the timing. Formative means that we are evaluating during the campaign's implementation. This allows for real-time adjustments and optimization of our materials distribution strategy. We won't find out at the end of the year that our message wasn't landing. We'll know in the first few months and pivot immediately. Primary goal and rationale. The goal of this phase is simple: assess the execution and materials to ensure our messaging is resonating and that our hyper-localized distribution is effective, culturally appropriate, and fully compliant. This is critical because, as we noted earlier, a major barrier is inaction driven by fear or lack of support. We must confirm that our urgent but empowering tone is overcoming that fear. Our rationale is to be sensitive and strategic. We need to be sure we are not unintentionally creating backlash or contributing to stigma, specifically by avoiding any form of blame or victim shaming. Key questions guiding our data collection. To achieve this, we are asking three core questions. Are the assets reaching the hyper-localized audience? We need to confirm our digital targeting is working for Wayne County and its various communities. Is the audience comprehending the preventability facts? Is our primary data point that 74.5% of these deaths are preventable being understood and accepted? This statistic is the foundation of our think objective. Finally, is the tone driving the desired objectives? Are people internalizing the message and feeling the personal responsibility needed to move into action? This tests our think, recognition, and feel motivation objectives. By focusing on these questions, we are assessing the core communication mechanism of the plan before we shift to measuring to the long term, hard to change outcomes like actual policy enactment. Introduction, the stakeholder mix. The success of our formative evaluation hinges on gathering input from a diverse and essential group of stakeholders. We structured this to include not only our internal team, but also the people we are trying to serve and the experts who validate our policy approach. This mix ensures our evaluation is both practical and principled. Number one, campaign core team. First, we have our campaign core team. This is our internal staff responsible for everything creating the infographics to managing the email distribution. The role in the evaluation is to be the numbers team. They will monitor digital analytics, tracking metrics like clicks, email open rates, video views, and crucial share metrics. This data tells us if people are seeing and engaging with our materials, which is our first check on the effectiveness of our distribution. Primary audience representatives. Crucially, we involve the primary audience representatives, expectant mothers, and frontline healthcare providers in Wayne County. We'll engage them through methods like focus groups and pre and post testing surveys. Their contribution is vital. They provide the qualitative feedback on message clarity, cultural appropriateness, and tone. They are the ones who can tell us what the real world barriers to action are, helping us refine the message to be more effective and empathetic. Number three, key partners and experts. Next are our key partners and experts, specifically the Michigan Department of Health and Human Services and the MMMS program staff. These partners are our accountability layer. Their role is to validate policy alignment and ensure that every piece of material we produce directly references and supports the MMMS program's priority recommendation. This ensures our campaign is grounded in sound public health strategy and not just good intentions. Number four, influencing audience. Finally, we'll seek the input from influencing audience, which includes select community leaders and policymakers. We'll engage them through short interviews or surveys. The goal here is to assess the think objective, specifically their recognition of the issue's severity, and most importantly, their belief in the achievability of systemic changes. If they don't believe change is possible, our due objective of policy enactment will fail. So their feedback is essential for early adjustments. Campaign discussion. The vision is to build a resilient, thriving Wayne County by tackling deep rooted systemic health challenges through coordinated public health strategies. This involves addressing local health disparities and preparing for external health threats to significantly enhance well being across the county. Background, the current situation. Michigan faces significant challenges in maternal health, with 467 maternal deaths reported between 2016 and 2020. Of these, 106 were classified as pregnancy related, with 74.5% of those deemed preventable by the MMMS program. Persistent racial disparities are evident, with Black women disproportionately affected. The campaign focuses on two key groups within Wayne County, Michigan, including Detroit. The primary audience consists of expectant mothers, healthcare providers, and healthcare advocates, in the age range of 18 to 49. These are the individuals most directly impacted or involved in maternal care decisions and outcomes. Complementary to this is the influencing audience, which includes healthcare providers, community advocates, and leaders. While no specific age range is targeted for this group, their geographic placement is also Wayne County, Michigan, as they are crucial for enacting the necessary policy and systemic changes to improve maternal health equity. Potential impact on improving maternal health equity. Our campaign targets the systemic roots of maternal health disparities, aiming for significant, lasting improvements for the priority population in Wayne County. Impact on preventability by focusing on the fact that 74.5% of pregnancy related deaths are preventable. The campaign will drive new objectives like mandating improved clinical protocols and integrating community support that directly tackle preventable causes. Addressing racial disparities, the campaign will force stakeholders to think and recognize the severity of racial disparities, the required do steps, implementing practice changes to address systemic racism and reduce implicit bias are designed to create a more culturally competent and equitable care environment, directly benefiting disproportionately affected populations, particularly Black women. Economic and community benefit, implementing the campaign's call to action, funding for doulas, home visiting is supported by data. States that funded doula midwife access saw a slower growth in maternal morbidity. Studies suggest that investing $1 yields an estimated $3 return in reduced long term health care costs, ensuring a lasting positive community impact. Shifting the social norm by motivating the influencing audience, providers, leaders to feel an urgent personal responsibility and do by actively advocating the campaign aims to dismantle the barrier of inaction, making advocacy the new safer professional norm. At this time, I would like to thank you for participating in my campaign. Again, my name is Juwanna Holley-Woods, and the campaign is Disparities in Maternal Care.